Members and guests. The co-authors and I are very grateful for the honor of giving this History of Medicine and Surgery lecture. We also are grateful to Dr. Grace Rizicki, who's a member, for doing all the graphics on the slides, which her husband could not do as usual. And the abstract has information that was prepared before I went to the Mayo Clinic, and the number of Charlie Mayo's publications skyrocketed after I went. So the big question here is, how did a small private clinic at the time, excuse me, in southeastern Minnesota become so involved with one of the most distinguished surgical societies based in the American South? It's a map of the United States. Rochester, Minnesota, location of the clinic is in southeastern corner, right next to Wisconsin, and the archival information of the southern is based in Alabama, as you all know. Now, interestingly enough, this is 1,902 miles, which probably wouldn't impress many modern travelers, but as I came to know, there were no planes in the early 1900s, and I had been told by older members of the Southern that the roads weren't that great either. So there were a lot of issues for the Mayo brothers to become involved with this society. When you give a history talk, you need sources, and this is Renee Zemer, a prototypical Mayo Clinic employee. She's been there running the history suite for over 2 decades. She knows more about the history of the clinic than really anyone at this point, and she's got it all organized, and it was such a treat for Grace and me to spend time with her at the archives there. This is me in the Board of Governors room in the Plummer Building in Rochester. This room, and you're only seeing a small part of it, contains all the awards and certificates that Charlie and Will Mayo garnered over their lifetime. If you want to feel really insignificant as an academic surgeon, spend some time in this room. None of us have done anything. It's really scary, but again, a wonderful visit. I used some other sources. For the younger members, there's a book describing the first 100 years of the Southern, 1887 to 1987, that the late Bob Sparkman, Dave Saviston, and Rainey Williams edited. There's also the famous Doctors Mayo book from Helen Clapesaddle, which was first published in 1941. And then there's Clark Nelson from the archival unit at the clinic called Mayo Roots. And then the greatest treat, I think, for both of us was to review the personal files of Charles Mayo. I got my hands on a paper that he had personally edited before publication, and it just overwhelmed me that they kept all of this material and you have ready access to it. And then Dr. Chung kindly directed me to the transactions of the Southern, which have an incredible amount of interesting information. I'm going to touch on all these areas, some briefly, and so we'll finish in the 20 minutes allotted. Everybody's heard of the Mayo Clinic. This is the starting point. In the center is William Worrell Mayo, who was an immigrant from England, probably 20 or 30 years before this, and was not a physician when he arrived in the United States. If I may read, he graduated from the Indiana Medical College in 1850. This college closed the same year, interestingly enough. During his lifetime, traveling west, he was a pharmacist, a tailor, a census taker, a farmer, a newspaper publisher, a justice of the peace, a ferry boat operator, and a physician and surgeon. The man had a lot of skills, right? And to your right is Will Mayo, the older brother who graduated from the University of Michigan Medical School in 1883, and Charles Mayo, the second brother and the younger brother to your left, who graduated from what is now Northwestern University Feinberg School of Medicine in 1888. By all reports, the lowest grade that Charles received in medical school was unfortunately a 7 in surgery. There were a lot of skills, again, in the two sons. This is a summary of Will Mayo's interests during his lifetime. Most of you will remember there weren't many specialists in the United States in the early 1900s. And over time, Will became incredibly skilled at abdominal surgery, particularly gastric surgery, as many of you know. And for trauma surgeons, he reported one of the first splenic repairs in Rochester. Charles was sort of ubiquitous, developed an operation for bunions, did the early eye surgery and ENT at the clinic, was famous for developing the treatment for tic douloureux around the turn of the century, practiced a fair amount of orthopedics, and as you'll hear, did a lot of thyroid surgery and urology, incredibly talented. The younger members may not recognize the name at the top of the slide, but there were two Haggards who have been president of the Southern Surgical. The first president in 1887 to 1888, W.D. Haggard, and then his son, who was secretary from 1901 to 1916 and president in 1917. The reason I emphasize Dr. Haggard is both Renee Ziemer and I think that the reason the Mayo brothers became involved with the Southern was because Dr. Haggard and Charles Mayo were very close friends. How a surgeon in Nashville got to be friends with a surgeon in Rochester is unclear, but presumably through meetings like this. And Haggard, younger Haggard, described, Dr. Will is a wonderful surgeon. Dr. Charlie is a surgical wonder for his ability to figure out complex surgical problems. The brothers and father got to be very successful. They gradually added people to their practice in this small but growing town in southeastern Minnesota. And this is the so-called first Mayo Clinic building in 1914. It's developed into this. I hadn't been back for a while. I could not find my way. It was scary. I mean, it's like all centers that are successful. So this is the main center in Rochester, Minnesota. Population has doubled since I was a resident. This, of course, was the second clinic in Jacksonville, Florida. Interesting story, as many of you know, but they now have their own hospital, their own campus, a lovely campus, and are the most popular medical center in the state of Florida. And lastly, Scottsdale, Arizona, as with many other institutions migrating to the Southwest, now the most popular medical center in the state of Arizona. Clinic sees 1.2 million patients a year. There are 65,000 employees, 4,900 of them physicians and scientists. And just the top two numbers should interest you. Of people who visit a Mayo Clinic destination, 1/3 have complex or highly complex conditions, and nearly 90% who come to one of the clinics for a second opinion receive a new or refined diagnosis. So let me tell you a little bit about how this all started. Dr. Haggard, the senior, is to your left, and to your right is a picture from Helen Clapesaddle's book. Again, without explanation, Dr. Haggard is mentioned in 9 separate places in this book, but never once does it say that he's a dear friend of Charles. They just put the picture in and quote him on many occasions. So again, I'm assuming this is where it all started. It's really interesting to see a little bit more about this relationship. This is Charlie Mayo in Presbyterian Hospital in New York City, where he was admitted with abdominal pain. He was unfortunately misdiagnosed, had one abdominal operation, pain persisted, they reoperated. It was not the original diagnosis. And Will, hearing that his younger brother was in difficulty in New York City, had enough power in the Midwest to command an engine and a train to get to Chicago. And it's a story that's familiar to many Mayo trainees, but here was the telegraph on Christmas Day to Charlie Mayo at Columbia Presbyterian Hospital from the Haggards, which I thought was really interesting. They kept it in the Mayo files, and again, I'm assuming there was a very close relationship there. Now, we know for sure that Charlie Mayo is an active member. Here's his dues notice in 1922. Dues were $15. The thing that made me feel really good was if you look at the bottom, he didn't pay it the first time. And so I felt really okay about all the times that I've not paid my dues immediately. In the book at the time, the membership book, they didn't bother to put a street address. They just put Charles Mayo in Rochester, Minnesota. He joined in 1902. He was 37. First paper was presented 2 years later, and Will Mayo is the lead author, but as you'll hear, Will didn't go to the meeting, didn't present, and didn't show up for another 27 years. From 1904 to 1934, Charles Mayo presented 23 papers at this meeting in 31 years. I'm one of the older members, and I remember Bill Scott from Vanderbilt and Jim Hardy from Mississippi somehow always had a paper on at this meeting, and that's what this reminded me of for the older members. He was a member until he died in 1939. Now, there's some great correspondence, but this is from Alton Oxner, who was the new secretary of the Southern, writing to Charlie Mayo. "There's no member of the association who has thought more of than you, and I personally hope that you will come because I am anxious, because it is my first year as secretary, to make the meeting as enjoyable as possible." I thought that was a very humble statement, frankly. Next year, same people, Alton Oxner to Charlie Mayo, "I'm indeed sorry that you will not be able to attend because you always add a great deal to the meeting, and I know that your absence will be felt by all the members." On another note, in 1931, this surgeon from a very famous group in Richmond, Virginia, as you all know, said to Charlie, "I am writing to ask that you present the golf trophies at the annual dinner. Your speeches on such occasions have always been one of the main features of the entertainment." So evidently Charlie had a very good sense of humor from all reports. Interestingly enough, when the Southern was going to go to Augusta, many of you will remember Clifford Roberts, a somewhat controversial individual who kept the Masters tournament and the Masters Club from African Americans and women. And evidently he knew enough to butter up, if you will, to Dr. Charlie Mayo. And Charlie responded, "I think that you were very kind to send me a guest card. I do not play golf, but I've had to learn something of the games, as I am called on so many times to give prizes." Now, we all worry about transparency in the modern era with ourselves, our staff, our patients. And a lot of us like to keep things private as professionals, but just to give you an idea of what it was like at the time, this is from the Daily Mayo Clinic Bulletin. "Dr. Charles Mayo leaves Rochester tomorrow night for the East to present a paper, Gastric and Duodenal Ulcers, before the meeting of the Southern Surgical Association." Can you imagine if your medical center tried to do that today with all the airport professors in the room? It's incredible. Now, John Van Heerden and I were speaking on the phone, and we were just going over the presentation a little bit, and one of us came up with, well, how the hell did they get to all these meetings? Because, the Southern used to meet in New Orleans, Biloxi, Mississippi, St. Augustine, Florida. I mean, all over the South. We didn't have the rotation that we now have. And if you look carefully in the background, they're in a railroad station. And sure enough, in the Mayo Clinic Daily Bulletin, to help the airport professors of the time, was of course the bus train schedule from Rochester, Minnesota, all of it to really Chicago or Minneapolis, where they could catch trains to other cities. So they spent a lot of time in train stations and on trains to get to our meetings. Here are letters in preparation for the next meeting. The Louisville and Nashville out of New York and the Illinois Central out of Chicago operate through sleepers to Biloxi. Another, there are short limit winter excursion fares to Florida. You're talking about 2,000 miles of trains. It's mind-boggling to all of us, I'm sure. And we're at the Homestead, and in 1933, the Homestead sent out a notice that announcing that, consistent with a slightly lower regular rate recently decided upon, the rate of $9 a day for all those attending the Southern will be reduced. I think we should show this to management at the Omni. Now, another thing that I really thought was interesting about Charles Mayo, who had a booming practice in Rochester, is that when he came back from a meeting, he sent notes like this to all his partners at the clinic and the Department of Surgery. And I just found this one fascinating. One of the interesting features of the meeting of the Southern was a moving picture by the president, Dr. Scott and White Clinic, Temple, Texas, which showed the use of an electrically heated knife for removal of the breast in cases of cancer. I also thought it was very gracious to mention the competitor. Dr. Crowell reported 4,700 cases of cancer from the Crowell Clinic. But we don't do this. I mean, I started doing it a little bit early in my career, and then, you know, you get busy, and, well, your partners will have to read the reports in the journals, I guess. So to get back to the academic side of Charles Mayo, these are the main topics of his 23 papers in 31 years. And they had a lot of numbers. And I remember, you know, Europe was fairly well developed, Germany, Switzerland, things like that. But the United States medical and surgical system was nowhere near that. And gallstones and liver, their first paper was 1,000 patients, and there were people who everywhere did not believe that this could be happening. How could two surgeons in rural Minnesota do this? And then Charles, over a couple of years, kept increasing the number of goiters he was writing about, and in 1907 presented a paper with 1,000 goiters. Really got a lot of people's attention. Both of them started attending more meetings, but clearly Charles was loyal to the Southern, and you can see the variety of topics that he discussed. There were also other interesting minor topics, if you will, including an interesting discussion of parathyroids, if Dr. Olson's in the room, and interesting comments about cancer. And then I tell you, I read this paper on preventive surgery, and it was bold and for the time, and he thought he could stop cancer and a few other things by certain operations. I'll quote a few words. This is from the original paper from the two brothers. In the 1,000 operations on the gallbladder, 15% involved the common duct. So I went to one of my textbooks, and of course it's still 10 to 12%. And this is in an era where record keeping, et cetera, was not ideal. I was really impressed with that. Another paper on goiter, particularly hyperthyroidism or Graves' disease, better judgment in selecting a favorable moment for operations with more careful preliminary preparation of the patient. That's important. And there were but 3 deaths in the next 40 operations for the disease. Now, Charles Mayo had a real advantage, right? The 4th partner at the Mayo Clinic in the original staff was Henry S. Plummer, widely regarded to be of genius capabilities. Came to the clinic in 1901. He developed the medical record system that is still in use at the clinic, and they have a number of how many charts they've lost in 100 and some odd years. He designed the building that I illustrated for you, and he designed the Plummer Building named after him in 1928, which is a national landmark. In his spare time, he studied patients with goiters, and these are the 2 really famous papers that he wrote in the early 1900s, one comparing Graves to multinodular goiter, if you will, and then, of course, his most famous contribution, the medical literature, administering iodine to patients prior to surgery for exophthalmic goiter. Here's a paper Charles Mayo wrote on gastroduodenal surgery. As the years have passed, it has been shown that gastroenterostomy, a common operation for duodenal ulcers at the time, as you all know, does not always cure ulcers, and that gastric ulcers are dangerous, some of them apparently developing into cancer. And finally, I thought this was really interesting. This is in a paper on cancer of the colon. The surgical treatment of cancer is now much more effective than it was 20 years ago. Look at the date. The operations are much more thorough, and fixed and locally advanced growths involving the primary and secondary lymphatics and those with contact growths or metastasis are treated by radiation. I simply had no idea they were that wise to the effects of radiation. I think the involvement of the clinic in the Southern Surgical reached its peak, if you will, at the 1931 meeting at the Greenbrier Hotel in White Sulphur Springs. The president, Hugh Trout, is from Roanoke. His grandson, of course, is a member, now retired in the state of Washington, and he wrote to me reams about his grandfather's relationship with Charlie Mayo. I didn't know that Mayo would get off the phone in Roanoke, spend the night overnight at the Trout home, and then Dr. Trout and Dr. Mayo would drive up over that wonderful road. 12% of the program that year of the Southern Surgical at the Greenbrier was for Mayo Clinic surgeons. Will Mayo appeared at the Southern for the first time ever. He was an invited speaker and gave a talk called An Appreciation of Southern Surgical Association Leaders. Charlie was there presenting his paper on peristaltic activity and was obviously a member of the Southern. Fred Rankin, a president of the Southern that I'll speak to you about in just a minute, was also a member and presented. J.D. Pemberton, whose grandson was my intern when I was a chief resident and who just retired, spoke on cardiac features of goiter. He was a member. And I had the privilege of meeting Waltman Walters before he died. He was the son-in-law of Will Mayo and famed at the time for resection of the bile ducts and biliary tract tumors. And he was also a member of the Southern. So a fair amount of interest in the clinic was present a long, long time ago. Brief comment about Will Mayo, the older brother. His invited address was an appreciation of leadership of the Southern Surgical Association. It is an incredibly gracious talk. He knew everybody in American surgery by this point. He knew many of them personally. He knew of their skills as surgeons, and I'd recommend you read it if you're interested in surgical history. Evidently, the talk was so well appreciated that the next day the Southern decided to make him an honorary member. He gave another talk, and it's published. And again, very, very good read if you have an interest in these kind of activities. We've had 3 presidents who were from the Mayo Clinic who became presidents of the Southern Surgical. Fred Rankin is one of the most interesting individuals in the history of the Mayo Clinic. He was the 50th president of the Southern in the years that are listed. He was a son-in-law of Charles Mayo. You'll notice that his time at the Mayo Clinic as an attending was only 6.5 years. And when you read between the lines, he didn't get along with his father-in-law perfectly well. And his impatience with the regimentation necessary in a large institution like the Mayo Clinic led to him either resigning or being dismissed by Will Mayo. It's not clear that Charlie even knew that his son-in-law was being dismissed, but Fred Rankin left the clinic. If you read, there's a book about Mayo Clinic surgeons that a lot of us have read. It's fascinating to read about this controversy because Mayo does not like controversy. You know, they're a very clean white clinic, and boy, you know. Fred Rankin was a major in World War I, commanded in a military hospital in France. As World War II came about at the age of 55, he rejoined the military as a colonel, became the senior consultant to American medical forces in World War II, was promoted to brigadier general and received the Distinguished Service Award to non-combatants. So he had a very illustrious career. And during my residency training in Rochester, I know I used a Rankin clamp. And I called John Van Heerden to verify that, and he said, yes, you did. Bob Coffey was known to me. He was the 80th president of the Southern in the years listed. He was a general surgeon aboard the USS Iowa and treated President Roosevelt on the way to Tehran Conference. Immediately after returning from the war, he became chair at Georgetown University. For 22 years, I overlapped with 3 years. Bob Coffey wrote my letters to get into Georgetown Med School through a family connection. He modernized Georgetown. He increased the number of surgical residents, he increased the length of the residency, increased the number of affiliates. And because the DC General Hospital, now closed, was not open to residents at Howard University, he opened it to residents at Howard, and one of them happened to be LaSalle Lafall, who became president of the college in 1995. Dr. Coffey also trained Kathy Anderson, the first female president of the American College of Surgeons, and was responsible with Bob Lee for the so-called Georgetown Prep. Remember all that? Where you didn't have to give all those meds, you just gave them some Inderol over the weekend and operated Monday. Had great results, I'd used it, and that was in 1972 and 81 at papers at this meeting. Finally, George Jordan, one of my mentors when I was at Baylor, was the 97th president. Probably Mike DeBakey's best recruit after Mike left New Orleans and came to Houston. Dr. Jordan devoted his life to Baylor Department of Surgery and Dr. DeBakey until 1994. He was the chief of staff at Bentob General Hospital, now Bentob Hospital, for 22 years. Look at this career. American Board of Surgery, RRC, chair of the Board of Governors, a regent, president of the Houston Surgical, the Texas Surgical Society for Surgery of the Alimentary Tract, and he's the only president, to my knowledge, in the history of American surgery to be president of the Southern Surgical and the Western Surgical in the same year. I mean, who did that? Come on. He's also responsible for editing The Surgical Diseases of the Pancreas with the late John Howard from Toledo. And he helped revivify pyloric exclusion, as all of you know, for trauma. The Shipley Award is one of the treasured awards to new members of the association. On final count, 11% of all the Shipley Award winners have some affiliation with the Mayo Clinic. John Kirkland, all of you know, won the award 2 years after he left the clinic and went to, University of Alabama. George Hollenbeck was recruited by Dr. Kirkland, and 2 years after he left Rochester, won for his paper on proximal gastric vagotomy. John Van Heerden, colon inflammation, myself, spleen. Bruce Wolf, who's in the audience, incidental cholecystectomy during colorectal surgery. Bruce, as some of you know, is from one of the most famous surgical families in all of Georgia, from Columbus. Father was a surgeon in World War II, wrote the best paper probably ever on small bowel injuries, and all three sons became surgeons. John Pemberton, again, who just retired, became a colorectal surgeon and 1 year for the ileal pouch. And Nancy had several excellent papers as a new member. One was on retroperitoneal adrenalectomy, which she was kind enough to teach me. And then, of course, she did all the research recently on who was Dr. Shipley. We did a survey to Southern Surgical Association members. I'm sure many of you received it from Kate in October of this year. It simply asked if you've ever served on the staff of one of the clinics, or if you graduated from the Mayo Med School or did your residency or fellowship, just email me. I didn't know what to expect from this. I mean, surgeons don't read their mail. A lot of them don't answer their email. I got just a flurry of incredible emails, some from people who had never trained at the clinic but had a clinic story. It was wonderful. I could spend an hour, but I have a few vignettes that I'll give you. Looking at the survey, I was a little shocked. Does this mean that with only 3% of our current members or senior members from the clinic that the relationship is going away? I don't know. I've never really counted how many of my peers and predecessors from the clinic are still active in the Southern. I thought it would be more. My wife reassured me, that's fine, David. Don't worry about it. So let me just finish up with a few vignettes. Hiram Polk was kind enough to tell me in 1964 he had a job interview at the Mayo but didn't take it. Mike Rowe from Chattanooga said, I never trained at Mayo, but I did go up there to learn endocrine surgery and spent 4 months with John Van Heerden and Clive Grant. Raleigh White was incredible. He was born at the Mayo Clinic. His father helped found the Scott and White Clinic. And the Scott and White Clinic, as many of you know, is one of about 6 or 7 clinics around the United States that are Mayo model. Absolutely Mayo model, at least until recently. Hugh Trout, again, his grandfather was a president, and he hosted Charles Mayo routinely before meetings in Hot Springs. Mark Catlick sent me an article from Jax about Dr. Harold Foss, who I did not know, who was the famous surgeon who helped found and develop the Geisinger Clinic, one of the most successful private clinics in Pennsylvania. And Ann Rizzo, whom you heard from yesterday, sent me pictures and documentation that Charles Mayo's sons, who became surgeons, were sent for their internship to the Guthrie Clinic, also in Pennsylvania, and again, one of the most successful private Mayo-like clinics in the United States. This is Dr. Foss, wonderful story about his surgical skills. He was like a Rembrandt of other activities as well, and helped Geisinger really progress. This is Charlie Mayo, with his son, Dr. Charles W. Mayo, 1926. His son is an intern at the Guthrie Clinic rather than at the Mayo Clinic, which I just found really fascinating. So the relationship between the Mayo Clinic, Charles Mayo first became a member in 1902, and the Southern Surgical Association is now nearly 120 years old. And this is truly an enduring legacy. And on behalf of the two thorns and a rose between them, we are really grateful for the honor of delivering this scholarship lecture. Thank you.